You had shared with me that you used to be a smoker, but you're no longer. So can you tell me your personal story of how you started smoking and what ended up making you quit?
Yeah, it's it's curious because I didn't start regular smoking until I was in my early 30s, actually. In college, outside of high school, as I started to work as a performing artist, I had occasion to be around it, and on the occasional basis, I would smoke with a drink. Right, I would have an alcoholic beverage, and then I would smoke with it. They paired well together. It was a very social thing, but I didn't do it regularly until I moved to Spain. I had been exposed to it as a child because my dad smoked a pipe. And in our family, he was gone a lot. It was a big family. I was the youngest in my family. He was gone, most of the time, such that when he would come home, he was so tired that the first thing he would do is sit in the living room, pack his pipe, and smoke. And it seemed to me a relaxing thing for him, right? Restful, I'm home now. And he would hold the match for my brother and I, who were the youngest, to blow out the match. And then I would stay with him because it was the only time I would see my dad. So smoking for me wasn't negative. It was the way I could be physically and, emotionally close to my dad when I would see him, and it wasn't often. So that was like a good time that I could be with him. That said, when I moved to Spain in my early 30s, I sold my stuff, was trying to make a life transition. Spain was still, at that time in 2004, public smoking was still very much a part of Spanish life, such that in all the cafeterias and all the, the coffee shops, restaurants, in the metro, it was smoking everywhere. And I was working so hard to build a life in another country that I was very tired. And what I didn't realize is that my body was actually starting to decline. I later found out I had an autoimmune disease, but at the time, to deal with the fatigue, to sort of fit into Spanish culture, I was breathing so much secondhand smoke, it was like, well, I might as well. If you can't beat them, join them, right? So I got the benefit of the stimulant effect of the tobacco because I was working so hard and so tired. And then it was something also socially that was just like a huge part of Spanish life still. So it allowed me to fit in. And at that time, I thought, I could drop easily, but it wasn't as easy to quit as I certainly hoped.
So how many attempts did it take for you to eventually quit?
Oh gosh, I think it probably took me 3, 4, maybe 5 times. And it wasn't something I talked about because once I came back from Spain, I wasn't an open smoker. It wasn't like the thing I did to be cool here. But I spent the next year, 3 or 4, probably 5 times, like, okay, I'm going to stop now. I'm going to make this change and then I'll be able to stop. And each time at just the minute I walked by somebody with a cigarette, that physical craving it was really hard to deny or to work around. And sure enough, I'd find myself, smoking again.
And each time you relapsed,
Mm-hmm.
how did you feel and how did you eventually kind of get your motivation up to try again?
Yeah, I think, in all kinds of people and the way we go about our lives, sometimes it takes a calamity.
Mm-hmm.
So, each time I relapsed, I tried not to take it personally or feel shame about it. But, there's just like, I couldn't do it, stayed in my mind, and it lowered my self-esteem. But actually, my body went into a crisis place. So I was later diagnosed with multiple sclerosis. But at the time, my first episode, I started to lose feeling in some of my limbs. And I didn't know why. And I was just like, I am talking with you today. And ultimately, I ended up in the hospital in a very serious situation. And, I realized that I was not in a place that was sustainable, that things had to stop.
Right.
And it wasn't just smoking. It was a number of things about my life that were not, and the choices I made that weren't helping me. I couldn't say no. I couldn't find a balance in how I took care of myself or how I worked with other people. I was just working hard, multiple jobs, right? Can you do this? Yeah, okay, I can do this, right? So it was that And smoking was something that just gave me that little bump of energy, but it was actually pulling away from my body at the same time. And so with a health crisis like that, it got my attention and done. Like, I'm not touching this again. Like, I have to survive and I have to be okay.
Yeah.
And I need to do this now.
Now, I completely know what you mean because I'm a former smoker myself. And I actually started smoking in my early 20s, and my friends and I had just gone to some party as we were graduating from college, and somehow the smoking just stuck with us as we all moved to New York, and then it became a social thing where we, and New York is kind of like Spain, in the 90s, where there was smoking everywhere. When I was working, I could go down and bond with my coworkers over smoking. When I was out partying, there was everybody smoking indoors, outdoors, and so it was just a thing. And then quickly it became I was no longer a social smoker, I was an addicted smoker. But then I started to kind of like tell myself all these things to keep smoking, like I told myself that smoking helped my digestion, and I had this routine where I would smoke and drink coffee, and that's how like I started my day and ended my day. And I wrote poems about smoking, and I just had all this emotional investment to smoking. And even when I moved to Washington State with my husband, who is not a smoker, and he really was very helpful in helping me quit, like Washington State is not a culture that promotes smoking, thank goodness. So like when I went outside, Microsoft to smoke, it wasn't like there was anybody there with me. It wasn't as fun anymore. So that I think helped me quit. But ultimately, I think for me, the thing that forced me to quit smoking was that I realized that I wasn't just addicted to smoking. I was addicted to like a way of life, just like you, Jennifer, that was no longer sustainable. Like I was addicted to the rush of like getting things done at the last minute, or like working through the night, or like, meet the deadline at all costs. I was addicted to like pushing my mind and my body constantly. And I realized like in order for me to stop smoking, I had to be okay with like things not being done as quickly as I wanted. Like, just being a different person and living a different life. It had to be a complete change. And so it wasn't just this one thing I had to change. And it took me, I had probably tried to quit, over 25 times over 3, 4, 5 years before it finally happened. And each time I quit and then I relapsed, I might have gone a little bit longer. So I went 3 months without quit smoking, and then I relapsed again, and then I tried again, and the next time maybe it was 4 months. But it was really hard to think that it was no longer affecting me, and then I might be watching a movie or walking by and I smell the cigarette, and all of a sudden it's like you're right back. And I realized like how powerless I am. Like all my willpower was not as strong as the cigarette. So it was really a scary moment for me to realize I am not in as much control as I thought I was. And Stephanie, I would love to hear your story, because I believe that you are in a family of smokers,
Yes.
and yet you yourself do not smoke.
No.
So can you tell me about how it felt as a child to grow up in a family full of smokers, and how you kept yourself from smoking?
Yeah, between the grandparents, because I grew up around mostly my mom's side of the family, and I believe both my grandmother, my grandfather, my 2 aunts, and then my mom, stepdad, and biological father, they all smoked at one point in their lives. Whether they smoked up until they passed away or if they still smoke to this day, it affected me. And to say I didn't try would be false. I did for like half a second. It was disgusting. I did not like it, but in hearing Jennifer talk and talking about the different progressions, I was very OCD about things, and I had people over to our house, and I had people with allergies, and they couldn't come over because of that smell. And when you're when you're living in a smoking home, you don't smell it.
Mm-hmm.
And so I'm like, oh my gosh, it smells. So I was like the cleaner of the house. So when I would have my friends come over, the house was like, I would clean just to get, that smell out of the house type of thing. And so when I moved out, my husband and I, both coming from smokers, we would come into our own home after being at each of our parents' homes, which his mom did smoke, and it would be in our clothes and our hair, and we'd literally strip before entering the house and have to feel like we showered just to get that smell off. So it would like revert back to my friends saying that smell. And it was like them coming from a non-smoking home into ours. It was like, oh my God, it's such a terrible smell. And I feel like it made me so sensitive to that smoking smell that every time it's like, you guys talk about smelling it and getting that craving, I smell it, and I mean, no offense to anyone, I get disgust.
Mm-hmm.
Because to me, it's like dirty to me, because I just remember that cleaning, like trying to get that smell, because those friends that were coming over wouldn't come over because of that smell type of thing.
Yeah.
So that just just brought that memory in there, and it's like, oh gosh, I feel terrible saying out loud, but that's what really I think started off and brings up that memory of like it just that strong sense of
So
smell.
for you, like the peer pressure actually had a positive role in terms of
Yeah.
helping you see things
The
from
other-
a different perspective.
The other way,
Right,
was
yeah.
like, I have to get the smell out.
Right,
Yeah.
absolutely.
Yes.
And so someone who grew up with secondhand smoke, as a child growing up in this family, I mean, can you kind of talk about some of the negative effects of commercial tobacco, for people who are not smokers, right? I mean, have you had trouble breathing at times, or have you felt like you were maybe more susceptible to getting sick or something just because you grew up in this household where smoke was everywhere?
Other than maybe having a better immune system, I don't get sick that often. I might have allergies now as I'm getting older, but I had sinus issues, still have sinus issues, but I don't know if that's just what happened in life. But my immune system is actually pretty well, and I might be a rare breed of myself, or just really lucky, but overall, like, my health-wise has not been affected with my lungs. And we were those kids in the car with both parents smoking and relatives smoking, and that's one thing with my own children that I did change with my life was like, if you are going to smoke, you will not smoke around my children.
Right.
That is one big change that I was very adamant about. My mother-in-law didn't necessarily listen to that rule, but my parents did abide by that rule, because I think they really thought about, the kids being back there and just kind of being hotboxed. So,
and it might have been because you were so very focused on cleaning that might have also kept your immune system in a good state.
Exactly.
Yeah.
Between the two, who knows? But yeah, I think I'm very lucky, because there are other people that have had health issues from the secondhand smoke, and I always do look at that.
So, if we're reaching someone maybe who is a younger adult or who is maybe somehow feels attracted to smoking or vaping, what is something that you would tell that person as a reason, like, do not ever touch that smoke or vape?
With having, teenagers now of my own, I ask those questions. I mean, luckily, with the education they do have in school, it does help. But also, what leads you to want to do it? What in your life makes you want to try it? With me, I go to that, I go like it's your teeth, your breath, the smells. I mean, definitely the smells is the one thing, and it's just what it leaves in your life and what it does to your body that it could do to your body. I mean, I'm just this, possibly have second smoke, damage that I don't know about, but doesn't show at this point in time. But there are people that are unfortunate that have that damage.
Yeah.
And just talk about, those issues that could happen. With vaping, I did have those friends that back in the day, that didn't want to be around the cigarette smoke, that ended up smoking and then go to vaping because they were trying to quit. And it's really hard, and then you hear about the damages that vaping does. So I educate those kids, my own kids and their friends, that this is what could happen to you with your lungs. I mean, why would you want to do that with your body? But I have to say the educational system, the school systems have been really good with teaching, because so far the kids have just asked questions, and as far as I know, they have not.
Yeah,
But I could
absolutely.
be wrong, but
Thank you.
but they have been amazing about asking questions about it. And they don't like the smell, I have to say. My kids are...
So they inherited that from you?
Yes, they get the whiff of the smell, and they're like, oh, that's a horrible smell. But they've been around their grandparents, and they don't like the smell either.
Yeah.
So, I just hope they stick with it. So, we'll see.
Fantastic. And Jennifer, now that you work in the public health setting and you're older and wiser, kind of,
Ideally.
what is it that you might tell the younger generation that maybe you didn't know in your early 30s, but you know now about how damaging smoking and vaping can be that you wish that other people would know?
Yeah, I guess it's multifaceted because I was an athlete. I was a triathlete. I'd done triathlons up until my late 20s. So I knew how my body felt when it was in peak condition and how I felt as my skill as a performing artist, as a piano player, creates a lot of fast, small movements. And I felt that agility before smoking. So I knew those things. But what I didn't realize that even though I wasn't, a chain smoker, even though I didn't have 20 years smoking, I couldn't have imagined how many years I still craved cigarettes and tobacco, commercial tobacco, even though I was no longer a smoker, right? Years. And had I known that, that would have helped me. But I think the other part of it is that sometimes when I don't feel the effects of something immediately, I can't comprehend it as negative or harmful. But I do think that the way the commercial tobacco industry has preyed on all of us is despicable. Mm-hmm. And if nothing else, if I would think about that in my early 30s when I was in Spain, of like, oh, by the way, you're funding these people. You're funding this type of business practice, right? It's tied to the horrors of, U.S. history, the horrors of, how people have been oppressed for hundreds of years. Had I thought about that, it would have been a social justice step to say, no, absolutely, you will never get my money, and I will never support this because it hurts people, mm-hmm. and I don't want to do that. So for me, it's kind of a mishmash of things because even though I was very physically involved, I couldn't tell you one day to the next, that was hurting something. And I didn't smoke much, so of course, minimal, right? All these little justifications, and yet thinking about how it hurt others was something that really motivated me. And it made it easier to walk past that cigarette, even though I still had a craving.
Yeah, I completely agree. And the comment that you made about how long that craving stays with you, I think the thing that I could have never imagined was that something that I did for about 10 years in my 20s, it would haunt me for the rest of my life. It took me over 15 years to get over the craving completely. It took 15 years. That is a long time span. And it took 15 years. I'm still, every year I feel like my body is slowly kind of rejecting more of the chemicals that are stored in my body because of the smoking. And the fact that my lung feels freer now than last year, it means that there's still some stored in there from all that many years ago. And it's a shocking thought that it has completely affected my body to the point where just now, I'm able to fully take in a deep breath, and I couldn't have done that 5 years ago. And so there are just so many things that it just stays with you in a way that I would have never imagined as a younger self.
Well, thank you for sharing that. It's powerful. Thank you too, Stephanie. It's been a really powerful conversation because, things are around our lives. We do these things and we make good decisions, bad decisions, decisions in between, but this is one of those where it has lasting impacts, whether we do or we don't, and it's important to try and think about. It just really helps me to listen and learn, so thank you both.
No, I do the same thing with Ask. My mom and I are very close, and I ask a lot of questions, because she has tried to quit a number of times, and after losing my mother-in-law, which happened to be on my daughter's birthday, which is coming up, actually this Sunday. It was a whole big thing that she made a promise to my daughter that she was going to quit. And that was a very big thing for her to say. And she did quit for a while, but she did start, and she was embarrassed that she did. And you spoke of that, where you didn't want to tell people that you were doing that you were going to quit. I'm going to quit today. But every time she said, I'm always very encouraging. Am I disappointed that when she, I find out that she's smoking? Yes. And she tries to be sneaky about it, but I can always smell it. And, I still have that hope that she will quit because I know she wants to, but I don't think people realize how much of that addiction is there and how hard it is. And all we can do is just keep on encouraging our loved ones to keep trying. And our ones that have not started, not to do it, because it is very hard to quit once you start that habit.